Hello and welcome back to our Carrier Product Update series, where we sit down with different representatives from insurance companies, third-party administrators, and other vendors in the insurance community to talk to them about their product updates so that you as an insurance agent have all the tools and resources available to you that you need to be successful in the market. My name is Jason Powers. I'll be your host today from Legacy Brokers, and I'm here with a good friend of mine, Hudson Moses, with Allstate Benefits, the artist formerly known as National General Benefits Solutions. Hudson's the group sales representative here in Kansas City. Hudson, welcome to the series.
Well, I appreciate you having me on, and like you said, it's excited to be here as Allstate Benefits.
It's great. It's great to have you. We've quoted Allstate Benefits as part of our portfolio of plans and options for groups for quite a few years now, and we've had a lot of success with your product. So we're excited to have you on to kind of share with our agent community the ideas, different strategies. I think that can help them in the market, particularly as we enter into the busy season. I think that's the most critical time for agents to kind of gear up is right before renewal season hits. I know what we see in the proposals that we get from Allstate. It's typically a pretty standard package of options, but you guys can customize benefits. You know, it's not that there's a grid that we pull from. You guys really have the opportunity to customize the plan.
Yeah. Like you mentioned, our plans are essentially a la carte. You kind of tell us what deductibles, what out-of-pockets, co-insurance, and we kind of build it to suit, if you will. The most popular we see out there is that $3,500 deductible spot. When you go any higher to a $5,000, the savings aren't as great, and sometimes there isn't even any savings. So that's one of our popular sellers, and we try to lots of times see it on the Aetna ASA network. I would say 9 times out of 10, that's the network people are going with. That's the biggest network we offer, and has the largest coverage coast to coast.
And certainly offers some premium savings, at least on the PPO model. But 3,500 being the sweet spot, I know that's one that we see a lot.
Right.
And our quoting team here at Legacy tends to, at least early on, would push back to you, hey, can I see this with a $5,000 deductible? But for some reason, actuarially, that 3,500 seems to be that sweet spot.
Yep.
Is that what you're seeing throughout the market, or?
Yeah. Like we mentioned, once you go above that 5,000, groups stay at that 3,500. It's a better benefit, and there's sometimes not even any difference in premium. Really. We see a lot of 2,500s, 3,000s. Little tweaks in there. And then core value is another one we're starting to see quite a bit. It's been standard for the past 3-4 years. About 30% of our book of business is kind of going with that core value model there. So
new cases selling coming in, you're seeing 30% go to core value. And core value, for those that may not know, that is
that's the reference-based pricing product that allows the employees to go to any provider they'd like. It's essentially an open network is how I like to explain it. And we pay off a percentage of Medicare, whether it's inpatient or outpatient. It's either going to be 130% or 150%.
Gotcha. So when an agent sees core value on that proposal, what they really need to understand is that is the Medicare reference-based pricing model. Explain to me, because we don't just see core value, we see the flex, we see access, we see some other things. What do all those terms mean?
Yeah, so under the core value chassis, if you will, we have core flex and core access. We like to explain core flex as core value with training wheels. It gives the group that open network feel for the first 4 months. And then in months 4 and 5, if they're not comfortable, they had a bad experience, whatever the case may be, they have the ability to jump to a full network. They can pick from any of the networks except Aetna ASA, so any network that's available in their area, and the rates won't change. They'll keep those core value rates till the remainder of the year, and then they'll have the ability at renewal to make changes as need be.
And that's a good strategy. So
Mm-hmm.
there are cases, I know of one in particular that we're working on renewal
Mm-hmm.
that went core flex to begin with.
Mm-hmm.
That is removing that flex option at renewal because there were no
Mm-hmm.
headaches, were no
Right.
problems with the RBP model. Then what is access?
Yeah, so Core Access is another core value product that we offer. It gives the group a network for their primary care, it's a PHCS network, which allows them to have a network for their primary doctors and then have open network for other services that they utilize.
Got it. An open network is essentially no contract, no
Mm-hmm.
pre-negotiated rates. Um, and I know some of the pushback that we get from the agent community on the reference-based pricing model is there is the potential, for
Mm-hmm.
some noise. There is the potential for balance billing. What is it that Allstate does differently to
Mm-hmm.
kind of help agents with that noise?
Yeah, with that, I would say, we see about a 2% balance bill rate since we've implemented the product. And if in the case of a balance bill, we have the MAP team, which is the Member Advocacy Program. They will handle things all things core value, whether that's an access issue, whether a member gets a bill that they're not sure what to pay on it, or they do get a legitimate balance bill. Um, if they receive that, they give the MAP team a call, and they'll tell them, what the right path of action is there, and we'll make sure we'll get them taken care of.
So then you guys take over from there. So and I think that's important. I think for agents to understand is I have experienced balance billing even in a PPO setting where the facility was contracted as in network, the physician seen in that facility was contracted as in network, but maybe the lab or
Uh-huh.
the anesthesiologist
Mm-hmm.
or the radiologist was not contracted, and so a balance bill comes in
Mm-hmm.
afterwards. But I think what's unique about your RBP model with core value is that you do have that MAP team. It's an advocacy program that does the outreach. It does require the inbound call though,
Mm-hmm.
and that is because no one knows when there's a balance bill
Right.
except for the provider and the member.
Mm-hmm.
And so I think just knowing that that's automatically integrated into your product makes it a more successful venture for agents that are presenting that. What can agents expect to see as a premium range or savings when moving to a core value versus a
Uh-huh.
full PPO like an
Sure.
Aetna ASA?
So, most times it's 10+%. There's some markets where we see almost 20% savings. Um, that's why we put it on all of our proposals. You'll see it as kind of mirroring the first plan on the quotes. That way they can see the savings, and it might spark some interest. Say, hey, what do we need to do to start saving some money here? So.
Certainly creates a conversation to be
Mhm.
had, and I think there's a lot of conversation to be had about your products and the way that they work, and your proposals are really well laid out. I
Mhm.
think a lot of the stuff that we touch on in our self-funded courses when we're teaching agents how to present a self-funded
Mhm.
plan, how to read self-funded quotes. The Allstate proposal is certainly one of the easier ones to read. Uh, that said, you typically, I know in our case, we see 4 or 5
Mhm.
plan options on there, and we're seeing a lot more groups move to, uh, maybe in the last seven years, we've seen a lot more groups offer multiple plan options.
Mhm.
What's that look like under the Allstate
Yeah.
model?
So there's a few, hoops you have to jump through in order to offer a dual option. First one is group size is going to determine how many plans they can offer. A group that's anywhere from 3 to 15 enrolled can offer up to 2 plans. 16 to 24, 3 plans. Anything 25 plus is 4 plans. Um, with the dual option comes a dual option load, is what I like to call it. It's going to be 2%. That's to administer the plan, 2 plans instead of one. And you might see some adjustments in benefits. That's due to the anti-selection factor in there that we're facing, but normally it's not too drastic. Um, we are piloting, just a flat rate on those dual options, so we don't have to worry about those hoops. But the other thing on those smaller groups that do want to offer dual options, they have to keep in mind 2 employees have to be enrolled in the richest plan, if you will.
Okay.
Oh.
Which then is the key for 3. If you're going
Mhm.
to go 3, you've got to make sure that you've got 2 enrolled
Right.
in the higher
Correct.
cost plan, the richer
Right.
plan of the 2. But that brings up another point, and that is that you guys, 3's not your floor. You'll go down to 2 enrolled.
Mhm.
You can't have dual option, but you can go to 2 enrolled.
Correct. Yep. We can go as little as 2 employees. It can be a husband and wife group. With that group, we have to see a 3rd employee. They can be part-time or full-time, and they don't have to be enrolling. Those micro groups, can be tough to get super competitive on. If it's a couple families, we do write them. But yeah, we
And,
have that
and no
ability.
industry restrictions.
Correct. We can write, non-for-profits, municipalities, 1099, W-2s, a mixture of both. We have carve-outs, pretty much, one-stop shop for any, whether it's a problem group for you or just a group you're looking for another solution for.
Sure, a lot of flexibility. I know we've seen again a lot of success with Allstate Benefits because of that flexibility.
Yep.
I smile because I keep wanting to say National General. It's going to take me some time. I think even internally with some of our systems, we still got you listed as Nat Gen, but I think there's a lot of flexibility in just the ability to customize the experience for the agent that goes out and presents that proposal. It's key to the success we've had with your programs. So down to 2, no industry exceptions or requirements. We can go any industry. It is a level funded or partially self-funded program, which fits very well with the model that we have here at Legacy and all the education that we put out into the market with our agents. What are some of the surplus? I know that typically you get pigeonholed into this. Oh, well, they only give 50% of the surplus back. How's that reconciliation look?
Yeah, so whatever's left in their claims account at the end of the year, they're going to get in the form of a refund. It shows up as delayed administration fee on our quotes. That's a question we see a lot. It's a fancy word for refund. But they're going to get 50% what's left in there. That's going to come 60 to 90 days after their run-out period, which is normally 6 months on the traditional plan, 9 months on core value. So easy example here, January 1 group, they finish up on December 31st, 6-month run out, and then 60 to 90 days, the group can see or expect a check in the mail for whatever surplus they have left in that claims account.
And that's a physical check going back to the employer. It's not an admin fee credit. They don't have the opportunity, right, to save or keep that money in the account.
Right.
You're going to automatically kick that back to the employer. And is 50% it, or I know
we
got some other
do have
options.
the 100% option. I will be upfront with you and tell you we don't sell it a ton because it's it's a guaranteed increase in rates for something that's not guaranteed.
Yeah.
You can't, as much as we'd like to predict people's health throughout the year, accidents happen.
Sure.
So we don't sell it a ton, but if a group does want it, we can do that, and they'll see about 8% increase in monthly rates.
Yeah, which is not terrible considering. I mean, if you're talking smaller groups, right, where everybody knows everybody in the group and can where there may be some predictable experience in that next year based on what they may know about their group, that may be a good option.
Yeah.
It also, I think, there are carrier plans out there in this, particularly in our market, where there's not the option to change that. It is 2/3 or it is 50%. It is what it is. It may be an admin fee credit, and I like the fact that it's not something where you're being tied to the renewal. It is something that money goes back to the employer regardless of whether or not they renew with you. And we see that with cases that may not. They may not stick around. The group may fold for whatever reason. They just decide they don't want to do group health insurance, or they move on to a different plan, or they get purchased by another company 6 months after the close of the policy.
Yeah, kind of like you mentioned, if they don't renew with us, we're not holding that refund check hostage. It's still going back to the group after that run out period has completed.
Yeah, and then I know as we kind of get into the busy season, agents are going to start seeing these proposals, and the one thing that we get asked about a lot is the comp structure.
Yep.
With a lot of the plans that are out there, there's not much flexibility in what that comp structure looks like. Talk us through.
Yeah.
All states.
So our comp is ran off of annualized premium. Every quote that you see or proposal you see is going to start with 7% baked into the rates. Agents and brokers have the ability to dial it up as high as 29 or as little as 0. If it's their own office or family friend they're doing something nice for, and it stays the same year 1, and then at year 2 it drops a point, and year 2 and beyond it stays at that point. So year 1 group is at 7% comp, or agent is at 7% comp. Year 2 goes down to 6. Year 3 it stays 6, and so on, as long as they're with us.
And that's and again, that's a customizable comp structure. It comes out the gate at 7, but
right.
If for whatever reason the group requires a little more work, or the agent needs a little more comp,
right,
we have the ability to push that up to make it make the agent whole on whatever work that they're putting in.
Yep.
Which is different, I think, than a lot of the products out there. I mean, there are some that go off of a PEPM, and I know we can do some simple math to help convert that back. But you're calculating it on the entire premium equivalent, so it's the fixed cost, which is your admin and stop loss premiums, plus the actual claims funding.
Correct.
That's what you're calculating as total premium, which kind of takes us back pre-ACA days, where the good old days,
right,
where agents were making 8 to 10% of total premium collected. You guys kind of have the upper hand there in the way that you structure yours.
Right.
So then, as we move into the busy season, something else that they see on that proposal is the pharmacy option and your PBM, because Allstate doesn't really administer the plans here. We've got Allied Benefit Systems, who might be the actual third-party administrator.
Correct.
Allstate's providing the stop loss policy. Who's your pharmacy?
We use Cigna. We just have one. We've had great experiences with them, and that's our Cigna PBM is who we use.
And I mean that seems to be a pretty good option. We here at Legacy we use Allstate Benefits for our own employee benefit plan, and I know that we've had experience with Cigna PBM and pretty standard formulary.
Right.
They've got a home delivery service that's pretty easy to use, but all of that's integrated into an Allied Benefits platform.
Right.
That's where they're getting their a member is going to get their actual claims data, the EOBs. They can look up their benefit schedule. They can look up the pharmacy formulary, and so that seems to be kind of another confusing conversation at post sale, post implementation, is who's Allied Benefit System? Where's Allstate's logo on the ID card?
Right. Yeah, so it's not on the ID card, actually. That's a question that came up a lot during this whole transition. National General's name was never on the ID card. It's going to be Allied. So groups that are currently enforced don't need to worry about getting a new ID card. And groups that are being put with us, in the future, it'll still say Allied. When they go onto their Allied portal, they will see a little bit different. It'll be, tailored to Allstate. But everything's going to, look and act as it was before.
And for clarification, because I know that can get confusing too, it's Allied Benefit Systems out of Chicago, Illinois, which is a third-party administrator on many, many self-funded plans.
Correct.
And they happen to be the administrator for yours.
Correct.
Good. So something else that came out of the pandemic, at least for over the last year and a half, is the increase in the frequency we see plans using the telemed benefit. Talk us through your option. Yeah,
so with telemedicine, like you said, it's taken the world by storm, if you will. We utilize the company Teledoc. It's going to cost about $5 per employee per month. We're loading it on all of our quotes. With everything that's going on, it's a safe bet that people are going to be interested in it. With that $5 per employee per month, there's no consultation fee. So when they pick up the phone and call the doctor, there's no copay. They have the ability to, explain to their doctor the symptoms they're having, and the doctor can send, a prescription if need be to their local pharmacist, and they can get it filled without even, leaving the house.
It's amazing how, I mean, this is not a new benefit in this industry, but it's amazing to me to see how many people are using it today who, 2 years ago would have thought, well, I'm never going to need to use that benefit. I go to my doctor, and so it's a welcome reprieve from walking into a doctor's office and having 25 people in the waiting room to see that more and more people are using that Teledoc.
Yeah, and on all our plans, like I said, there is no consultation fee except for the core value HSA. It's a $59 charge, but everything else, it's included in that.
So even on the PPO HSA plans, you guys are doing Teledoc consultations, no charge.
Correct.
That's great to know. Great to know. All right, as we wrap up here, a couple things I want to mention. I know ancillary is kind of it's always been. We've always had a contact in your office for ancillary, but there's been some changes and some new, I think, maybe a new marketing effort, particularly with the Allstate acquisition of National General. So what are our options on the ancillary side now?
So we have a few different options, like you mentioned. As far as the Allstate side of things goes, it's called Small Market Solutions. They handle voluntary benefits such as, accident, critical illness, hospital indemnity, life, disability, all of which are guaranteed issue. If that's something, the agent, broker, or even the group's interested in, they can let me know, and I can connect them with, the appropriate rep that's in their territory. And then as far as ancillary goes, we have Allstate Benefits self-funded dental that we can tag in on along with the major medical. We have Nippon, which has dental, vision, disability, and life. And then we have Beam, which is dental and vision. We've seen a lot of people utilize Beam lately. Get that free Bluetooth
Electric
toothbrush.
toothbrush,
Right. But yeah, we have lots of options, and our ancillary specialists are really good at what they do. So if that's something the group's interested, we can definitely get them squared away.
Perfect. I know we've had a number of groups recently want to integrate into whatever options that are being offered there. So there's a shift for sure, at least on the groups that we work on. So value adds that make Allstate Benefits a little bit different than the other carriers on the spreadsheet. What are some things that don't make the spreadsheet?
Right. I mean, you've probably heard it a million times, and like we like to preach to to our agent broker community, we'll take the 10 easy groups that you guys would give us, but where we really hang our hat and where we really see success and relationships build is those hard to place groups. Whether it's one that slipped through the cracks and is close to that effective date, whether it's a micro group like 2 employees, husband and wife, churches, mixture of 1099 W-2s, pretty much anything we can take a stab at and put something in front of the client. Our service and turnaround times, we like to think we're the fastest in the industry, and I think we're pretty good at it. Quotes you can expect same day, next day. Pre-screens or firm offers, 2 to 3 days, closer to that 3-day mark in the fourth quarter, and then we can have groups implemented by the end of the week. There's some good value out there as we roll into this fourth quarter.
Absolutely, and I can tell you that from our experience, we appreciate the partnership with your team. We can echo that turnaround time is the fastest in the industry. We know you're the first quote in every time.
Right.
So and we appreciate the ability to get those turnaround quite quickly. And then we have situations where it is last minute. It is a case that we didn't get a chance to look at it until everything else failed, and they're trying to figure out what to do with that group. And so being able to work with your team on a dime to get things turned around and come up with a strategy or a solution for some of those tougher cases. It's not for everyone, right? I mean, we know there are cases. It's not to say that, hey, you're going to take everything, but you'll give everything a fair shot, and you'll let us know pretty quickly, which is I think is key to success in this industry. You've got to be able to get stuff turned around fast.
Right.
Well, with that, Hudson, I appreciate you coming on. It's always fun to spend some time with you and talk about where this industry's heading. I greatly appreciate the partnership with Allstate Benefits. Look forward to a great fourth quarter.
Yep.
To the agents out there, thank you for joining us for another episode in our Carrier Product Update series. We hope you come back for more content as we deliver it. Until then, if you've got a case that you're looking at right now and you're trying to put the puzzle pieces together, give us a call. We love to sit down and put those puzzles together with agents all day long. Have a great fourth quarter, and we'll see you next time.